I wanted to just remind you all how I like to do these community talks. I think that when folks come to talks like this, they come not to hear a pedagogical expose or somebody expounding on the research as it relates to a particular topic. I think that's often professionals and families and clinicians that have concrete questions. Many of you come to these types of lectures with actually a specific question in your mind. So what I always like to do for a community lecture is, rather than giving you all of the science, I'd like to give you what I think the bottom line is and give you an overview and a summary of what I think the salient and most important issues are, and then leave most of the time open up for discussion, because I think that that's what you're here for. So both the remote sites as well as the folks that are here in Halifax, I'll give you the overview of what I think the most important issues in this topic are, and then I'd like to spend the majority of the time just discussing it with you and answering whatever questions you have. Well, who wants to hear this actual sentence quoted by a 5-year-old whose mother had just died? "When is mommy coming home from heaven? I've been waiting and waiting." We all want to protect our children from loss in life. We want to protect our children from any type of loss that they experience. And we particularly want to protect them from losing someone important like a parent or a sibling. But the truth is we're really not able to protect them, and that all children and all living beings will experience loss at some time in their life, and that most young children do experience some type of loss. So we actually probably end up producing more problems than we solve by trying to inappropriately protect them from experiencing appropriate grieving. Well, when the loss occurs, what we're here tonight to talk about is, what do you do about it? When it happens, what can you do? What can you do to minimize the damage to your child, and what can you do to minimize the damage to yourself and get on with your lives? Children understand death, of course, differently at different ages, so it's very important for us to understand that when we're working with our kids, if you have a 5-year-old who's experienced a loss, it's not the same as your teen who's experienced loss, and in fact, it's not the same as your loss that you're experiencing. So we'll spend a little bit of time talking about that. Grieving, of course, can also take many different forms. So again, this is the overview of the summary, because every situation is going to be specific to the child and the family and is going to require a specific response. I guess what's critical in all this is whether somebody's lost a grandparent, a parent, a sibling, there are steps that you can take that we know will have an impact on the grieving process and make it tolerable, make it more bearable, perhaps help you get through it maybe somewhat sooner, and maybe be a little bit better on the other side of the cave. So what I'd like to discuss with you today is some common myths about children and grieving. I'd like to go through some general stages of children's grief so you can have sort of an anchor to see where you are with your family if you're going through this. I'd like to really spend some time focusing on the developmental expression of grief. In other words, how is grief expressed in a typical 5-year-old as opposed to a typical 10-year-old, as opposed to a typical 15-year-old? And then what are some tips that I would suggest in fostering age-appropriate helping for that particular child? I'd also like to talk to you a little bit about how to talk to your grieving child, because I do think there are things you can do that help, and I do think there are things that you can do that are not helpful. And then I'll just have some further very specific suggestions. In terms of specific things to do, I think my thought was that in the discussion portion of the talk tonight, we'll be able to go into in much more detail specific things you might do. Now, just with regard to that, I'm happy to answer all of your questions. It's actually unethical for me to specifically answer a specific question. So when you ask me a question, people always ask about their specific situation, and it wouldn't be ethical for me in a setting like this to direct a response to that. I couldn't possibly have enough information to give you an intelligent response, but it can suggest a topic that we can then discuss, and the topic may provide some guidance in your question. So these 8 myths about children or loss are from the Hospice Foundation of America. If you Google Hospice Foundation of America, you'll find that there's a wonderful resource for information about death and dying and grieving and loss. I was very privileged to be a volunteer for the Hospice Foundation of America for a couple of years when I lived in California, and it's a wonderful organization that does wonderful work. Well, there are people who think that children do not grieve. There was a time, and less than 20 years ago, when our brethren in the medical community felt that children, young children, particularly babies and infants, didn't experience pain, which of course is totally not true. We now know, and no one believes that anymore, but as long as 20 years ago, they were not using general anesthetic to do major surgery on infants because they were concerned about compromising the respiratory system and weren't worried about the pain that was being inflicted on the child. This is sort of in a similar vein that some people feel, well, children have too immature of an emotional system in order to be able to experience the pain of loss, the emotional pain of loss, and of course that's ridiculous. It's not true. If you're around children at all, you can see children grieving, so that is patently untrue. Children of all ages grieve, but the grieving looks different, and that may be what's a little deceptive. How a 3-year-old grieves, or even a 2-year-old. A 2-year-old can experience the loss that occurs in a household and the frustration that occurs in a household when a parent dies. Children express grief in different ways, so that may have led some people to believe that younger children don't experience grief. The death of a loved one is the only major loss children experience? Not true. Divorce is a major loss for a child. Moving is a major loss for a child. Anything that disrupts the household can be a major loss for a child. And I think this is something that's very important to grasp. Even if a child is at an age where they really can't understand the permanent nature of death, as an adult can. They're cognitively incapable of understanding and feeling death of a loved one like we do. They can still feel the change. They can feel the change in the household. And as we'll talk about a lot tonight, children thrive in a predictable, knowable world. And when a parent especially dies, or a sibling dies, that world becomes chaotic. And that's terrifying for children, and children are responding to that. Children should be shielded from a variety of losses. Well, you can't shield them. And the effort to shield them causes more problems than it solves. Now, I gave a lecture a while ago and wrote in our newsletter about children and disasters. And I think it is a good idea when some natural disaster occurs to not let children endlessly watch television showing like the 9/11 attack over and over and over again, but to try to keep your children from seeing it at all or discussing it at all is going to create more problems than it solves. Unfortunately, life is a lot about loss, and your children are going to have to learn to deal with loss just as the rest of us are. And as parents, I'm a parent of 8-year-old boys, as parents, it's our responsibility to help prepare them for the world, and life is about loss in part. Children should never or always go to funerals. Well, I'll give you a secret insight into psychology here. Promise not to tell anybody. The correct answer to any psychological question is always, it depends. That's always the right answer. And that's the right answer here as well. So should children go to the funeral? Maybe. Should children not go to the funeral? Maybe. It really depends on the family, the situation. It can be very helpful, of course, as a part of the grieving process. But it's a decision to make with your family and your pastor, and any boilerplate decision is not going to be the right one. Children get over loss quickly. This is a tricky one. I'm working with a family where this actually came up, and I was happy to be able to explain it to them. You can see, and it happened in my own family, I can tell you that when my mother died, I was over at my cousin's house, and I was crushed. And they were laughing and joking, and it just made me furious. It made me furious that they weren't experiencing it the way I was, these young cousins. And the truth is, children they don't have the emotional equipment because of the way their level of development in their brain. You don't have an adult-sized brain until you're about 16. So the brain is continuing to develop over the first 2 or 3 decades of life. So a child particularly is not cognitively and emotionally capable of experiencing loss the way we do, or sustaining that feeling. And sadly, we're able to sustain feelings of grief for long periods of time. A child can't, thank God. Maybe it's a protective mechanism. But they'll be very upset, very sad, And then you'll see periods where they act like nothing happened. They'll pop into it, and then they'll ask some question that knocks the wind out of you, and then they're off doing something else, a totally different world. So it is not true that children get over loss quickly. They feel lost in an age-appropriate way, just the way we do. Children are permanently scarred. It is not true that children are permanently scarred by this kind of a loss. Are children permanently changed by it? Of course. We all are. If you have a loss of this magnitude in your life, it's going to change your life. You are living in a different world than the world you would have been living in had your brother survived, had your mother or father survived. I was working with a family in Miami, and this was actually a teenage boy, and his brother had died 10 years earlier. And the issues that we were dealing with were issues related to the loss of his brother 10 years later. Because from his perspective, his parents had never gotten over the death of their son. And as he described it to me, they had a little memorial set up in the house. And the pictures of this boy were everywhere, many more pictures of him than of the son that was alive. Now you can think, well, that kind of makes sense, doesn't it? Because they can look at the live child, but then the live child has to look at all of these pictures of his brother everywhere. And he was having significant adjustment issues as a consequence of the death of his brother from 10 years prior. Talking is the most effective approach in dealing with loss? No, it can be very effective, but it may not be effective. How does this come up? I teach adolescent development at Dow, or at SMU, and we were just talking about this in terms of adolescent development. Everybody in here, in common wisdom, knows this, demonstrates this, and it's also substantiated by the research that women, when dealing with powerful emotions, talk. They talk to their family, they talk to their friends, they talk to their mother, they talk to others. What do men do? 2 words. Play golf. Men deal with powerful emotion by engaging in activities. And women typically, again, we're talking about just overview, deal with powerful emotions by talking. So in my work with children with cancer, you can do the math and see the conflict, because mothers want their 8-year-olds who are being treated for cancer to talk about the emotional experience of it. That would make them feel better. And I have to help the mothers see that for a lot of little boys, that won't make them feel better. What will make them feel better is playing Nintendo with them. What makes them, talking about it will make them feel worse. So there's that natural conflict. And of course, it happens between the mothers and the fathers. The fathers deal with the chronic illness of their child by activities, not by talking about it. So it's a problem. Forcing a child, boy or girl, to talk about something they don't want to talk about, bringing it up all the time as a consequence of your anxiety about it, your concern about the child, is probably not a good strategy. It's understandable that people want to do it, but you have to be very careful about it. We'll talk a lot about this, but being open to your child, being acceptance, creating an environment where they know they can talk about it if they want to, but bringing it up all the time with your child is probably not a terrific idea. Helping children deal with loss is solely the family's responsibility. Well, what I mean by this one is, and what hospice means by it is, there are a lot of resources in the community to help your child. The school can be a wonderful resource. The teacher can be a wonderful resource. And there are many community groups and support groups that you can get hooked up with. You're not in this by yourself. You shouldn't think you have to do this all alone. And there are many resources we can hook you up with if you're having trouble dealing with your child's adjustment to a loss, as well as, you're not the best person in the world if you've lost your partner and your child is dealing with it. You're not 100% available for them either. Stages of children's grief. Now, anytime a psychologist starts talking to you about stages, it's just arbitrary. It's kind of a general rule of thumb, and it's kind of the way things go, but you shouldn't take it as if it's a roadmap of how to get from here to Digby. It's general guidelines. For example, probably many of you, if you work in the field, are familiar with Kubler-Ross's stages of dealing with grief and loss. And they're very nice, and there's some truth in them, and I'm tempted to put them up here because they're so nice, but the truth is the research has not fully supported that, and some of that happens to some people and some of it happens to other people, and it doesn't happen in that order, so I kind of avoid it because the whole anger denial thing is just, it's just not, it gives people the impression that that's what's supposed to be going on, and everybody doesn't go through all of that, and the research has supported that. Well, disorganization. So what do we mean by that? The initial expressions of grief in children range from everything you can imagine, frankly. Regression, going back to earlier stages, and we'll talk more in detail about this. Temper tantrums. In younger children, you see exaggerated fears. You see physical symptoms starting to occur, stomach aches, headaches, a lack of concentration at school, lack of concentration at home. And in older children, particularly in teenagers, you may start seeing things like mood swings. The disorganization of early grief is a real and genuine crisis for children, and it would be helpful for you to have somebody help you get through it and not just have to go through it on your own, because of course you're in crisis as well if you've lost your partner or your child. Even in this stage, parents and loved ones can help the child through this crisis. Now, I wanted to mention at this point also, I had a slide in here at the end which basically said, how do you know when you need professional help? And I thought, no, that is wrong. You need professional help when it happens. When you spend $100, go to a psychologist and have them talk to you about this so that you know how to, so you get supported and so you know how to respond to your child prophylactically, so that you're not dealing with you're not fixing a problem, you're preventing a problem. So I thought, my best advice to you if you've had a loss or when you experience a loss in the future, God forbid, that what you do is, and people have done this with me, that you go to see a psychologist early on just to check in, just to find out what the issues are, what you should be looking for, and to see if you need to establish that relationship, to see if you need to come back. I know it's a little bit like ambulance chasing for me to tell you that, but I really believe it's true. And I've had that many times where families, both here and in Miami, where I worked at the Children's Hospital there, where people have come to me, loss of a family member, seems to be fine, what should we do? Siblings of kids with cancer all the time. This is what they're doing, this is what they're saying, what should we do? And then I go through it with them. I actually give a version of this lecture to them, and we talk about the specific child, and then I'm ready to see if they need any further help from me. And the truth is, often they don't. It's one visit. After the disorganization stage, which is probably the most traumatic for everybody, there's a transition stage. A transition, you're getting to the point where you're losing the energy to be fully engaged in the tantruming and the fears and so on. So feelings of helplessness and hopelessness start to arise in this situation. This is where, if your child's going to start showing signs of depression, this would be where you would start to see them, really. I should also mention that, as I'm sure many of you know, depression in younger children is hard to pick out. Depression and anxiety look very similar. And depression in a young child can look like anger. It can look like irritability. So in an adult, it's very easy to find out if they're depressed. You say, are you depressed? They say yes or no, and then you know. But with kids, it's hard to tease out. It's hard to tease out what's going on with them. So what you're really looking for are not signs of depression. You're looking for mood changes. You're looking for a difference. You're always looking for something that's different than their typical behavior. Irritability is a good one, for example. Older teenagers will exhibit depression. With teenage girls and depression, you always have to be careful because depression in teenage boys just stands out more. Depression in teenage girls is a silent killer. I'm sure, as you know, it's not uncommon. Teenage girls are at high risk for suicide, and part of the reason is that nobody knows there's anything wrong. They're just sitting quietly in the back of the classroom, not creating any trouble, and the people that are most surprised are the parents when it's too late. More common symptoms also during this transition stage are withdrawal and even aggression or giving up school. School failure is not an uncommon problem you see here. Maybe it starts out as lack of concentration, but not uncommon that I've seen in my clinical practice for children to start refusing to go to school. Well, are they really refusing to go to school? It's probably multiply determined. First of all, they don't want to leave their parents. They don't want to be separated from home. They don't want to go to what now feels like a less safe environment. And they're probably not doing that well. And they probably feel disconnected from everyone. They may even feel that everybody's looking at them if the loss is common knowledge. So it can be academic problems can be very significant. The final stage is reorganization. This is when the emotional energy in all of the painful emotions that you and your child have been experiencing start to wane, and you can start pulling back from the situation. Detachment is the phrase that people use, but what I mean by detachment in this is that you can remember something without experiencing the emotion. So you can remember the loss, but don't have the flood of emotion when you think of the loss. You'll never forget the loss, but you won't always have a powerful flood of emotion every time it comes into your memory. During this stage, children usually have more energy. There's usually more motivation for moving forward to a positive resolution of their grief. Now, somebody tonight is going to ask me, so I want to head you off at the pass, what the amount of time we need to look at for all of these things. And I can tell you that my belief is that nobody knows for sure. Everybody's different. Things take the amount of time they take. The rule of thumb that people often cite, clinicians often cite for adults, is 6 months. That if you're still crippled by grief at 6 months and incapacitated, then that's complicated grief. It's pathological and you should see someone. Although, again, my view is you should have been seeing somebody long before then when you've had such a traumatic thing happen to you. With a child, it really depends on the child. I think what you do is you look at the child's behavior and you say to yourself, is he or she having more good days than bad days? Over time, they should start having more good days than bad days. They should get back to their old self. If a couple months down the road, that's not a very long time, but still, if a couple months down the road, they're still having more bad days than good days, and they haven't gotten back to themselves, that's something that I would be getting help for. I wouldn't be waiting until it's some arbitrary date. Common reactions to grief and loss. So these are just sort of, I'll get to specific ones, age-appropriate ones in a moment, but I want to go over sort of generally, because you may have seen some of these actually in yourself. Acting out feelings rather than talking. So you may see your child do things that are inappropriate. Rather than talking to you about their feelings, they may just become aggressive or tantrum. And the reason I wanted to mention this to you is, you know in your head that that's what this is about, but it doesn't make it okay. If it was not okay for your child to slam the door shut and throw their books across the room before your husband died, it's not okay now, and you can't let it be okay, because behaviors can become instrumental, which means that a child can learn to do them because it's just part of their behavioral repertoire. So we see kids, for example, who get prednisone when they're in cancer treatment, and they become brats. They just become and it's really the drug makes them very labile, their moods switch up and down, and they become very irritable. So the parents cut them a lot of slack. Well, guess what happens when they're not on prednisone anymore? They're still like that, because they've learned to behave like that. So you need to know that your child may be expressing feelings through actions, but if their behavior is inappropriate, it's still inappropriate, and you need to do the good parenting setting of limits that you would have always done with them. One of the things you're always looking for, this is, you can go through a whole list of things to be concerned about, but what you're really looking for are changes. Is your child eating more or sleeping more? Is your child eating less or sleeping less? Eating or sleeping more. Eating more or less, sleeping more or less, behavior patterns changing. You're just looking for change, any change, because with your child, the expression of it may be different than when somebody else's child. Of course, this is very common, wanting to sleep in the bed with an adult. My feeling about that is, what the heck? Now, people have very strong feelings about this. I can tell you they're all culturally based. There isn't a shred of evidence that it damages your child psychologically to sleep in your bed, period. I mean, in some cultures, the family group sleeps together, period. Usually tribal cultures, but it's just the way we've organized our life in society. So we have little rooms, and if you think about it, if you pull back from our culture and think about it, the idea of having little rooms where everybody goes and sleeps, particularly young children, is kind of odd. It kind of makes more sense for everybody to sleep together at some point from a certain perspective. I don't think this question has come up to me a lot, and I don't think at all, if it's not disrupting the marriage bed, which it could, I mean, it depends on the situation, obviously, if a sibling's died. But if it's not disrupting the marriage bed, then I don't see anything wrong with it as a brief period of time to help the child through this period. Now, of course, anything can become a problem, and I worked for several months with a mother who had lost a husband, and there was a child that started sleeping in the bed, and then it became a whole monstrous thing. So even a good thing can be turned into a very bad thing. So we spent a lot of time getting the child out of that bed. So again, the correct answer in psychology is always it depends. In that situation, it was a bad idea. You are likely to see some kind of regressive behavior in your child. We see this a lot with diagnosis of cancer. When children are diagnosed with cancer or any long-term chronic illness that is life-threatening and scary, and the child is in the hospital a lot for treatment, it's not uncommon for us to see the children start to just act younger. They do things that like they did a year or two earlier or younger. And so bedwetting or thumb sucking can start to reappear. Thumb sucking usually doesn't start. It would be just usually a re-emergence of it. Being angry, frustrated, and restless. Again, anger is a common emotion that you wouldn't think. When they have a loss of a person in the family, I guess we all know about being depressed, but do we know about being angry? People get plenty angry. Kids get plenty angry about this. And from all sorts of sources. They can be angry at the parent who left. They can be angry at God for killing their parent. They can be angry at the other parent for the way they're now being treated. Anger is a common and dangerous emotion that we have to be alert to in these situations. And that's one of the things I do like to talk to kids about, is what they're angry about. And I think when parents hear first of all, their child is angry, and then what they're angry about, I think it can be quite shocking for them sometimes. Lack of concentration and energy at school, we've discussed. And anxiety at separation from parents, I see this one a lot, that the kids just don't want to be away. The parent can't leave them alone. I had a mom who could not take a shower because the kid wanted to be in the room this little girl wanted to be in the room while the mother was taking a shower. She could not be separated from her. Well, let's go a little bit more detail in specific ages, specific age groups. We'll look at preschoolers, we'll look at school-age children, and we'll look at teenagers. We'll look at typical symptoms, and we'll look at typical ways to help as an overview. So as I said, bedwetting, starting to bedwet, again, is not uncommon. Thumb sucking is not uncommon. Being much more clingy than previously, of course, is very common. You do see a lot of exaggerated fears expressing themselves, particularly at bedtime, particularly at time when the child's not engaged in activities. These feelings start to come out in my experience. There may be much more tearfulness. The child just may be crying a lot more, and for no apparent reason. You can't really, in other words, by no apparent reason, I mean, you may not see what the trigger is. There likely is a trigger. You just don't see what it is. All of a sudden, you look over and your child's crying. I would say more common than excessive crying is temper tantrums. You see a lot of temper tantrums, and temper tantrums come out, and these kinds of behaviors come out as a result of change. So if you moved or were going through a divorce or had some other big change in your life, big job change, some family stressor, I would not be surprised to see a young child start to exhibit temper tantrums again. Regression, just acting at a younger age. And stubbornness. So the world has taken something away from the child, so it's not surprising that many children, and probably in an adaptive, healthy way, want to put their foot down and try to control the things they can control. And one of the things you can control is the expression of the word no. So the fact that the child may start being more stubborn and refuse to give in can relate directly to their experience of feeling helpless in the world. Well, what can we do to help the grieving preschooler? And we'll talk more about talking to children in a moment, but of course answer their questions. Answer them honestly and directly. Answer them in an age-appropriate way, but answer them. Don't dodge questions. If your child asks you a question, you should answer it. When my wife and I used to, in Miami, We used to take our children to daycare with us. They were in daycare at a very early age. And so the boys were in the back of the car, and they had to be like 3 or 4. I don't remember the exact age. And we're driving in the car. And out of the clear blue sky, one of them said, "Papa, am I going to die?" You know, and you just, for those of you who have children, you just feel like somebody kicked you in the stomach with a jackboot. It's just, and what do you say? What, have any of you had that question asked of you? Anyone here in the audience? What did you say?
I just said that basically everybody's got to go sometime.
So everybody, I'm just repeating this for the, everybody's got to go sometime.
We don't have a choice.
It's, you know, the truth is, if a person is religious and has a religious background, it's kind of easier for those folks because when you have religious beliefs, one of the things that those religious beliefs do is give you answers to some of the big questions, and so you can tell those to your children because you believe them. For folks who don't have those beliefs, it's tougher.
I'm sorry.
It's okay. I'm not sure I turned mine off. What I told my children was, and this is, I don't know what I would do the next time, but what I just said off the top of my head is, well, honey, we're living things, and all living things die. And I said, your body is not you. You live in your body, and someday you may not need your body anymore. And then your body will die, but you won't die because you can't die. I mean, when you die, when your body dies and you don't need it anymore, then you'll go to heaven like we will, and live with God forever. So that's what we said, because that was our religious belief. So we could say that. You shouldn't say things like that, of course, it goes without saying, if you don't believe that. So, I mean, you need to be a huge believer in being honest with kids, because it will come back to bite you. You know, they hear everything you say, and they don't forget anything, particularly if you're not talking to them. They remember it all. Provide simple routines. Remember what's happening is their life has changed. They're responding not just to the loss of a person, they're responding to a huge change in their lives. And so the sooner the house settles down, the sooner you get back into some sort of routine, the better it is for the child and the whole family. So providing them simple routines, getting them involved in household activities on a predictable basis is going to help a lot. And I hope it goes without saying that giving your child a lot of affection and nurturing is a good thing. You can't give your child too much love. You can't. It's impossible. It is not giving your child love when they throw the book across the room and you don't punish them. That's not love. I mention that because it gets mixed up. So people think I'm showing nurturing and love for my child by letting them get away with murder because their mother just died. No, you're not doing them any favor. That's not loving at all. In some ways, the truth is you're probably doing it for your own feelings, because you would feel bad about punishing them in a situation like this. But you know, you need to do the right thing. But giving them a lot of love, a lot of affection and nurturing is always the right thing to do. And trying to stay connected to them, but not in an oppressive way, like how are you feeling today, how are you feeling today, but engaging in activities with them, doing special things with them, connecting with them is very important. So they feel connected to you because they've lost another important connection. Provide lots of opportunities for play, to have fun. Remember, at this age, we're not talking about talking to your 4-year-old about loss. We're talking about engaging them in activities. I wouldn't jump all over regressive behaviors like thumb sucking. Bedwetting can be a problem, obviously, a bigger problem than thumb sucking. Depending on how old they are, thumb sucking can be a big problem because of the teeth coming in. But I just wouldn't jump all over them about it. I would be more gentle with it than perhaps otherwise and take it slow. And by provide opportunities for the expression of painful emotions, what I really mean is doing activities with your child. So for example, I wouldn't sit down with a 4-year-old and try to talk to them about their emotions. Who does that? 4-year-olds don't do that. What do 4-year-olds, 5-year-olds, 6-year-olds do? They watch cartoons. They watch Disney movies, they watch other movies, and so be smart. Find a movie that has loss in it. Find a movie where some important person dies. Show them Bambi and watch it with them, and you will get an expression of emotion, and it will give you an opportunity to discuss it with them without you jumping all over. All you're doing is watching a movie with them, and don't bring it up. But if you sit and watch the movie with them, I guarantee you a lot of the time, those emotions are going to come up in the child, and they're going to want to talk about them, and you're going to be there, open, willing to discuss it with them. So in other words, be sneaky. I'm a big believer in sneaky parenting. How do school-age children express grief? Now we're talking about 5 to early teenage years. Of course, since the children are now in school, learning problems can become a huge problem. If kids start refusing to go to school and you let them stay home, never, ever, ever, never, ever, ever, ever let your child stay home except when they're sick. Don't do it. Don't go down that road. You may get away with it, but I see a lot of families where it's just such a slippery slope. And it's such a problem, and it compounds. They're missing things from school. They're avoiding negative feelings. You conquer negative feelings by confronting them, by not by avoiding them. This is how anxiety disorders destroy people's life. Anxiety disorders don't kill people. They put them in a box because people with anxiety disorders, and this can become an anxiety disorder, spend their whole life organizing their activities to avoid feeling bad. Well, you're supposed to feel bad sometimes. And how you learn to deal with that as a person is by confronting it and learning how to deal with feeling bad. A preoccupation with the loss and related worries, daydreaming, trouble paying attention. So this isn't exactly post-traumatic stress disorder where you have intrusive thoughts, but you do see an expression where the child is constantly worrying about things, not just this, worrying about all sorts of things. I've seen kids start to worry about being kidnapped. A parent dies and they worry about being kidnapped. So you don't really see the connection, but it's there. Or they're just daydreaming, and it's because they're having trouble focusing and staying on task and paying attention. Again, bedwetting, regression, and developmental delays can start to occur. Eating and sleeping problems, as we talked about, nightmares and sleeplessness. The nightmares, in my experience, I don't know the research on this, so this is just my experience. You know, there's night terrors and nightmares. Night terrors are are in the same category of disorders as sleepwalking. It's usually a stage people go through. It's terrifying for parents. You can't rouse the kid. When you wake them up, they don't remember being frightened. They don't think they had a nightmare. It's a night terror. Nightmares, you can wake the child and they can tell you what the nightmare was. In my experiences, we're talking about nightmares, not night terrors. If kids start having nightmares and during this period, my experience is they tend to be real nightmares, and they can actually talk to you about what the content of the nightmare was. A lot of fighting and anger with sibs particularly. So what can you do? When you ask them to do things around the house, keep it simple. They still need to do the things that they need to do to help around the house, but don't make it complicated, because you're dealing with somebody who's having trouble paying attention. And if somebody's having trouble paying attention, don't give them 3 things to do. Give them 1 thing to do, and give them clear instructions. I cannot, if you could just leave here with 1 thought, this might be it, that the importance of providing a structured environment that's predictable and consistent. That is so important, and it's the hardest thing for a child because such a huge disruption has occurred in the family life. And you know, kids are terrified by things like if the father, actually could be either parent nowadays, but in the past, if the primary breadwinner leaves and the child knows that this is the primary breadwinner, they're worried who's going to pay the bill. Are they going to be able to pay the bills? Are they going to be able to eat? The kids are worried about things like that. So kids need to feel, they need to grow, and they will thrive in a safe, predictable, structured environment. This is Tuesday, this is what we do on Tuesday. Wednesday, soccer night, this is what we do on Wednesday. We go to soccer. And then we have ballet on Thursday, and then we have hockey on Saturday. Oh no, that's my life. That kind of structure, that rigid structure, can be very, very helpful. More so than all the chats with psychologists, frankly. You have to contain acting out behavior. I just keep saying this because it's what I deal with in my clinical practice so much. It's not okay. Regardless of yes, their father just died, yes, their mother just died, yes, their sister just died. It's not okay. You have to put that in a different part of your brain and say, you cannot act like this. You cannot, I know you're upset, but you may not talk to me like this. I don't talk to you like this. You may not talk to me like this. You just have to have the tough love to do that for your child's sake. Encourage them to let you know when they're worried or having a difficult time. And you know how you do that? By not asking them all the time if they are worried and having a difficult time. It's the butterfly phenomenon. You chase the butterfly, you don't catch the butterfly. You stay perfectly still, the butterfly will land on your shoulder. That's the way to think about it. Be available, be open, don't be critical, and they will talk to you if they're going to talk at all. They may not talk at all, but they're not going to talk by you badgering them. And by you badgering them and trying to get them to talk about powerful emotions that they may not want to discuss, the door's already closed, you may be locking it. Preteen and early adolescents express grief, physical symptoms, headaches, stomach aches. They are able to verbally express emotions better by the time they're teenagers, so they are able to talk about how they're thinking and feeling, whereas toddlers and preschoolers and school-age kids may not be able to. They're much more likely to be able to feel and express feelings of helplessness and hopelessness. That, you know, bad things can happen to you and there's nothing you can do to avoid them. And the problem with that is there's truth to that. Bad things can happen to you and there is nothing you can do to avoid them. But there's more to life than that. You can see an increased risk-taking behaviors and self-destructive behaviors. It's ironic, really, that you see some loss, and now you see a child who's engaging in behaviors that may result in them loss. So I've seen this many times. You have the death of one sibling, and then the other siblings start engaging in behaviors that could cause them to die as well. I had a patient like that last year, a sibling that I was dealing with. The one sibling had a very serious chronic illness, and the other sibling was engaging suddenly was engaging all these risk-taking behaviors, and we were afraid about suicide. It's not uncommon. Oh, and teenagers, a lot of angry expression, aggression, fighting, oppositional behavior. I mean, they're already doing that, aren't they? So just more of that. And again, teenagers are already withdrawing from adults, particularly during the early stages when they're becoming more autonomous, but it's a further withdrawal beyond what you would typically see and have seen. And of course, real depression. Teenagers are able to express, experience, and have true depressive episodes. Again, lack of concentration and attention, which may impact schoolwork. Testing the limits and identity confusion. So, you know, one of the major tasks of adolescence is to figure out who the heck you are. You're not a child anymore, and you're not an adult yet, so what are you? You see a lot of adolescents, of course, trying on new things. They try on clothes, they get piercings, they just, you know, they're experimenting with who they are, who they want to be. And one of the things that allows them to do that safely is having a safe base. They're a little bit like a kite tied to a rock, and the kite's floating around, but the kite's always tied to the rock, and the rock is the family. Well, when the family gets disrupted, the kite can kind of get broken away and flitter off, and it can result in identity confusion because the teenager doesn't have that safe base from which to experiment and try on new things. So helping grieving preteens and early adolescents. You, first of all, accept that they're going to experience mood swings and physical symptoms, that you're supportive with them about that, but you're not all over them about it. You do basically the kinds of things you do as a parent of a teenager anyway. You accept that they're going to be moody. You don't try to get them not to be moody. You don't accept inappropriate behavior, but you also don't try to get them to act in a different way than they're going to act as they're going through that period. When they will talk to you, if they will, you should want to encourage them to honestly recognize their painful feelings and to direct them into pro-social outlets, physical and creative outlets. And again, it's not the operant word there is not make them, it's encourage them. That's all you can do with a teenager. You can encourage them, give them opportunities, engage in activities with them, suggestions. With an older teenager, the two of you might do something together that would be creative or would be a physical activity, would provide an outlet for these powerful emotions. Empathy is a big thing with teenagers, and listen for the feelings behind their words and actions when they do choose to speak to you about their experience of this. It's extremely important with all family members, I would argue, to be truthful and factual in explaining a loss, but I think it's particularly true with teenagers. They will never let you forget it if you lie to them, if you try to hide things from them. That's not the way to support them. and help them develop, maintain their sense of identity, just as we were talking about before. So this may include things like not getting so upset when they come home with blue hair. You know, if it was kind of okay for them to have blue hair in the first place, maybe you don't want to be jumping all over them about it as they're experimenting with this new sense of themselves. And you might consider letting them make more choices that are not harmful. Now, we're not talking about drugs, but we're talking about blue hair. Or we're talking about other kinds of choices where maybe you would have tried to assert a little more control over them at this age. Maybe it's okay to give them a little more control in life because they've just had life tell them that control is an illusion, that we have no control, and that no matter what we think, no matter what our plans are, things can be ripped away from us. So giving them a little more control, letting them make a few more decisions can actually be quite helpful. I want to spend a little bit of time just how to talk about loss with kids and give you the benefit of my experience with that. First of all, people are very afraid to talk about death and loss. When I was in Miami, I developed a course for physicians, for pediatric residents, on how to talk about death with patients because it is such a tough topic for all of us. It pushes all of our buttons. It affects all of us. Everybody in this room is going to die someday. Everybody in this room is going to have experienced the loss of loved ones. So it's a very hard thing for people to think and feel about, and most of us would rather just not talk about it at all. Children do not benefit. In fact, none of us benefit from just not thinking about something or, quote, just put it out of your mind. First of all, you can't. You know, don't think of the pink elephant. That which we resist persists. You can't not think about things, and the harder you try, the more they'll be there. I was working with a mom that was having a very difficult issue related to feelings of guilt about something related to her child's early treatment. And what she expected me to say, which everybody else was saying, was to talk her out of it, was to say, well, no, this wasn't your fault. Everybody in your situation would have done that. I didn't do that. I said to her, which is what I recommend to all of you in this kind of a situation, if you're having obsessive thoughts, don't try not to have them. Have them. Plan to have them. And so I said, you know, I'm in no position to judge whether you did the right or wrong thing. Clearly, you think you committed a crime against your child. So I think that you should set time aside to think about it and think about what you did, how you could have done it differently, what you need to do to make up for it, and how you need to move on. But you need to be in charge of that. Not when you're driving the car, you know, not when you're at work, not when you're at school, but at 4:05 in the kitchen. Sit down, make a list, get a cup of coffee, and beat yourself up. And that can be extremely helpful because you're just taking charge. And, you know, you try to talk people out of things never works. You know, don't think that, don't feel that. Telling people not to feel things is a dead end. Share your own feelings or thoughts. Now, this is a tricky one because you can't get in the position of having them solve your problem. You have a problem. They need you to help them solve their problem. So you're sharing your feelings and thoughts in order to help them, not to get them to help you. So that's what's tricky about it. When your child starts turning to comfort you, you've gone too far. But for them to see that you experienced the loss is powerful and important. I tell physicians that. You lose a patient, you know, you've done everything you can. Let the family see how you feel about it. Do any of you know the movie Shadowlands about C.S. Lewis? No? Terrific movie, greatest movie in the world about loss and about romance and true love. Shadowlands, I recommend everybody run out and buy it. But there's a scene where the wife in it dies of cancer, and there's a scene in it where and she had a son from a previous marriage, and there's a perfect scene in it where, I should put it in the PowerPoint of this, where C.S. Lewis, the writer of the Chronicles of Narnia, is talking to this boy up in the attic, and he's talking about how much the little boy talks about how much he misses his mother, and C.S. Lewis starts crying and says, I miss her too. That's what I'm talking about, that type of response. Invite your children to talk about their feelings regarding death. If appropriate, and if it comes up, particularly with older kids, there are many books out that you can read to your children. There are many movies about kids for movies about death and dying that you can get for your kids. Our palliative care service here has access to all of that material, and we can give you, if you need it, we can get you some resources on that. But those can provide an opportunity to have an appropriate talk about loss and death of their child. But I would recommend doing that long before your child ever has to face it. It's better to, what we tend to do is not deal with these sorts of issues until we have to, till the house is already on fire. Then we go buy a fire extinguisher. And it's better to have talked to your child about death and about, to face these things front on and not just be reactive. And this is hard to do for us, but I think it is important to try to see things through your child's eyes when you're talking to them. Try to understand your child's perspective on things. Children who have magical thinking, like if they're 6 or 7 or 8 years old, 6-year-old whose brother dies may feel they killed them. And you go, well, that's ridiculous. Don't think that. How could you think that? He died of cancer. Well, but I said to him that and this is a quote, I said to him, if you're going to die, I want my mom and dad back. Why don't you just go die? Well, that happened. That child died after that sibling said that to that child. And that's what I was seeing the sibling about. Because that sibling felt they had killed literally had killed their brother, their sister in that case. So understanding, trying to see the world and seeing the death and loss experience through your child's eyes will help you and guide you in how to interact with your child and how to talk to them. Don't talk to them like an adult. Well, talk to them like an adult, but don't talk to them like they're an adult. That's what I meant to say. This is what I was referring to before. Be careful of your own expression of emotions in front of the child. I was working with a family not too long ago where the mother was having a horrendous problem dealing with her loss and dealing with an accident that occurred with the other parent. And she was just crying all the time. She was upset all the time. She was having these horrible conversations that she was repeating to me in front of this child who was being traumatized by the conversations that the child was overhearing from his mother. You have to find a better time to do that. You need to do that. You need to talk to your family members. You need to lose it sometimes. Just don't do it in front of your child. Find some other time to do it. Go in the other room, close the bedroom door. Just don't do this in front of your child. So that's different from the showing the true emotion. This may come up where it's not your loss in your family, but you may find out that your child is in a classroom with a child that's experienced a loss. And I just want to throw this in as a pitch for help with that this may be a good opportunity for you to help your child understand somebody else's loss. So when they have to confront loss, as they will in their life, they'll be better prepared for it. And I just put this last one in. For another's loss, teasing is completely out of bounds because I've confronted it before, where their classmates are teasing about deaths. And I think letting your child know that that is just so incredibly unacceptable is important. I mentioned this also earlier before. Children can't tolerate long periods of sadness. So you'll see your child be very upset. They'll say something, they'll ask a question, you may talk to them about it, and then 5 minutes later they're playing games, they're doing something else. Don't hang on to that sad moment. Let the child be your guide and move with them. So some specific activities to help cope with a child beyond what we've talked about. As I said, involve your child in activities. That may be more beneficial than taking them to a psychologist. A good psychologist you go to a psychologist, and the psychologist will say, involve your child in activities. There are many topics that a psychologist could talk to a child about, particularly issues of anger, depression, anxiety, and that could be beneficial, so I don't want to make light of that. But you can do a lot yourself by just getting a structured, regular routine and get your child doing stuff, and that can be incredibly therapeutic. Establishing a new family routine is very important. Your life has changed. Your old family does not exist anymore. It doesn't exist. That future is gone. And so you need to build a new future with your child and your family. You need to build a new future with them. And as horrible and painful as that is, as soon as that structure is in place and as soon as you're moving forward to that new future, things will get better. It's not a bad idea to give an older child a journal, particularly girls. Boys too, but particularly girls. The gift store here had a great thing that we gave some kids. It was a journal that had a pen that wrote in invisible ink, and the pen had a light on it, I think. Do you remember that, Trish? Did you see that? And you could turn it around and then see what you wrote. So then the journal locked, but if you didn't have the pen, like it's a black light kind of thing, if you didn't have the pen, you couldn't read anything in the journal, which I thought was so cool for teens. course, as a parent, I would buy the black light too. There are a lot of grief support groups available, and it's not a bad idea if your child's willing. I'm not so sure. It depends on the situation, but I don't know if I would force a child to go, but I might make them go 1 or 2 times. But I don't know if I'd make them keep going, but they can be, if they're good, if they're doing a good job, the child will want to go after going once. And they're not bad for you to attend either. Making a memory quilt or a memory box with treasures from the loved one. I haven't done this with anyone, but I think it's a terrific idea, and so I assume it would be helpful. And find a good therapist. Find a guide. You know, a therapist is somebody who doesn't know your family yet, but knows the ground, knows the territory. Really more like a guide, a coach. And when you're going through difficult times, it doesn't hurt to have, you know, when you're in the jungle, it's not a bad idea to have a guide. Take-home message. This must be getting to be near the end. Children have age-appropriate experiences of grief and loss. All ages. 1-year-olds, 15-year-olds, you. We all experience loss and grief. And it's important to recognize and validate the child's feelings. And it's very important to speak with them honestly and directly about death and grief. And you should be open and willing to talk with your child about grief and loss. There are so many ways we can directly and indirectly communicate to our children and others that this is a taboo topic. So rather than trying to force a child to talk about something they don't want to talk about, what you should do is create an environment where they feel safe to talk about it if they choose to talk about it, and let your child be your guide. Well, thank you very much for your attention.